Welcome to Insights. I'm Dick Goldberg, and our subject today, the effectiveness of psychotherapy. Does it help? If it does some techniques work better than others, or is it perhaps the therapist? One's good, one's bad? Why not just take a pill and forget it all? We're going to explore the world of effectiveness, or the technical term efficacy, of psychotherapy with our guest, Dr. Bruce Wampold. He really is the guy to talk to about this because he wrote the book. He's the author of The Great Psychotherapy Debate, which reviews the research on this subject for many years. He's written 100 published works, many of them in this field. This is his area of specialty. He was until recently the chairman of the Department of Psychology. I've got that wrong. Counseling Psychology. Thank you. You just heard from our guest, Bruce, at the University of Wisconsin. And thanks for being with us this morning.
Thanks, Dick. Glad to be here.
Bruce, if you take a look at this whole field, and I guess we're going to end the interview with the first question. If you have mental health problems, are you better off getting psychotherapy, or should you just wait out your problems?
Well, it's pretty clear. Psychotherapy is a tremendously effective practice. So
Wow.
It's been researched, many clinical trials. It's as effective as medications for many mental disorders. It's more effective than many medical practices that are very costly and have tremendous side effects.
Medical practices.
So
What would be an example of that?
psychotherapy, if you compare it to all the treatments in cardiology, for instance.
Oh, I see. If you're getting
Psychotherapy is much more effective, yet
No
we
kidding.
pay phenomenal prices for many of these medical practices.
That answer surprises
Psychotherapy
me.
that's relatively inexpensive.
How do you
is
compare
effective.
heart treatment to psychotherapy?
Well, they have a statistic in evidence-based medicine called the number needed to treat, which
Okay.
is the number of patients that need to get a treatment to get one additional success.
Okay.
So aspirin is a prophylaxis for heart attacks.
Yeah.
129. So 129 people have to take an aspirin to prevent one heart attack.
Oh, my goodness.
The NNT for flu shots is 12.
Uh-huh.
So
So that's very
peop-
effective.
12 people have to get a flu shot to prevent one case of flu. Well, the NNT for psychotherapy is 3. That means 3 people getting psychotherapy. One's going to have a better outcome than if they hadn't received psychotherapy.
Okay. Now, that's great compared to the other treatments, but what you're saying is 2/3 of the time it doesn't benefit you and 1/3 it does?
That's correct. It doesn't sound as encouraging, but when you compare it to the medical practices, again, it's tremendously effective.
I wasn't planning on going there, but this is very interesting. Can you give us some other examples of common physical maladies and effectiveness,
Well,
if any come to mind?
again, I have to think this through. My
Yeah.
examples were aspirin as a prophylaxis is 129. Most cardiology is like 10 or 12.
That's like an intrusive method?
Or the medications as well.
Wow, okay. So psychotherapy really stacks up well
Yes, it
compared
does.
to other things.
So the average person receiving psychotherapy is going to do better than 80% of the untreated people. That's another way of thinking it. That's pretty good.
Well, wait, I'm confused. If 1 out of 3 people benefit from psychotherapy, wouldn't it be they do better than 1/3 of the people? Because
Well, let's not get into the statistical analysis. of
The
this,
bottom
'cause
line
it's
is yeah.
hard to convert from one to the other.
Okay.
But I think in terms of description, to say to somebody, if you receive psychotherapy, you're going to do better than 80% of the people
who don't get
didn't.
it, who have the same severity of problem and didn't get it.
That's right.
Well, that's very good.
That
You'll be in the top 20% of that
Yeah,
group
yeah.
in terms of okay. So psychotherapy does help, but I have a feeling there's more nuances than that we're going to get to. Do some techniques? Let's say you're depressed. Is that I think either it's depression or anxiety that are the most common reasons people see a therapist. Do you know the answer to that?
Well, it's depression, anxiety accounts for, I think it's about 70%
Okay.
of outpatient.
I assume depression's in the
services.
lead there of the two, but I'm not positive.
Actually, the anxiety disorders, I think, are
They're number one?
number one.
Okay.
But I'd have to go back and...
Okay, let's take depression, because anxiety disorders is a big group of things. Depression's a little more homogeneous. Are some techniques, like cognitive behavior therapy versus insight therapy versus whatever, better than others to help people with depression?
Well, it's interesting you focus on depression. It's very clear in the area of depression that there are many successful treatments, and no one is better than any other. Cognitive behavioral therapy for depression is the most widely researched psychological treatment in existence, yet in clinical trials that compares it directly to other treatments, it's no more effective. So there's a variety of treatments. If you go to the Society of Clinical Psychology, to their webpage on treatments, there's 10 or 11 treatments that have been subjected to clinical trials for depression and found to be effective.
Equally
effective.
This is
with
hard.
Very different bases. Some, as you say, are insight-oriented. Some are very behavioral. Some focus on affect. Others focus on interpersonal relationships.
Well, wait a minute. This is contrary to protocol. I mean, almost everybody's saying you've got to do cognitive behavior therapy, which, for those who might not know what that means, is rearrange your thinking about how you're viewing events so that your thoughts aren't making you anxious. You reframe your thoughts. I'm trying to make it quick for people so they understand this, but if you are depressed because you feel you're terrible student, you might say, well, I'm not a great student, but I'm good at something else, and people don't just like you, or you're not of value just because you're a student, and you feel better, changing your thoughts, right?
Yeah.
Am I got that pretty close for what
pretty
CBT
close.
is?
It's you talk to the CBT people, it's a little more complex than that.
Sure.
But the theory is that the way we think about the world and our attributions that we make about ourselves, about others, and about events can be modified in ways that are more adaptive.
Okay. So if you are depressed, Bruce, which modality do you think would work on you?
Well, it's the advice I give people who ask me this question is find a therapist who is good and gives a type of treatment that you find agreeable. Now, for some people, cognitive behavioral therapy, and I use it with some patients myself, is absolutely terrific, okay? But other people want to get better in different ways, and they find the kind of structure of cognitive behavioral therapy and the focus on thoughts not to their liking. So if you look at the clinical trials, there's a significant number of people that drop out of these trials because they don't like the treatment.
Wow.
So if there's many treatments which are effective, then patients ought to have the option to pick the one that best fits for them.
So when you do counseling, I didn't know you were doing psychotherapy, but when you do it, are you flexible, or do you have a favorite technique you like to use?
Well, I think flexibility is one of the characteristics of effective therapists, that they modify the treatment so that it's acceptable to
So
the
you've
patient.
learned from your own research something about doing therapy.
Yes.
Okay.
Yes.
Isn't that hard to do, though? Are you as good at each technique as the other technique?
Well, I don't say that I can do any kind of therapy, but I think every therapist ought to have 3 or 4 different approaches with which they feel comfortable, so that they can then adapt it to the particular person they're working with.
Okay, so what does the customer do? Walking in to see a psychotherapist, they're depressed. They don't know what they want. How does that negotiate out so that the therapist, assuming they're as knowledgeable as you and have 4 different tricks in their bag of how they can treat the depression, how does that negotiate out so that you get to the right place?
Well, if you're seeing a therapist who's good, they will work collaboratively with you to find the best way to overcome these issues.
Yeah.
And so one of the things we know from research is that good therapists are able to form this collaborative working relationship across a variety of patients. It's one of the things that characterizes good therapists.
So they have to be flexible people, these therapists.
Flexible, and but they're also convincing. So sometimes you go to a therapist and you say, well, this really isn't what I want to do, but that therapist is really persuasive that this method will help you.
Mm-hmm.
And often patients will go, okay, I'll give this a try. And as long as there's this collaborative work, psychotherapy has a good chance of being effective.
Is it important that you sense your therapist is confident?
Confident?
Yeah.
Well, I think whenever we go to any kind of practitioner, whether it's a physician or even a lawyer, we want somebody who's realistically confident.
Yes.
They believe that, and that's another characteristic of effective therapists, they're optimistic or hopeful.
Okay. I mean, if I have arthritis in my big toe and I want someone to operate, I don't care about their personality because they're just going to operate on my big toe. If they come in full of enthusiasm or they come in flat with a personality, it doesn't much matter as long as they're good technicians.
Right, but you have to make that determination, and every person that goes to a psychotherapist makes that determination. We do it with physicians too. Mm-hmm. Is this somebody who we perceive to be competent and invested in helping me?
I guess what I'm behind my question is, does the confidence of the therapist, if he or she exudes confidence, help you in treatment because you believe, the placebo effect? This person can help me.
Yes. I don't want to say placebo effect without kind of talking about this more fully, because sometimes we denigrate, it's just the placebo effect. But very definitely, we, as consumers, need to believe that this therapist understands me and has a plan to work with me that will be successful.
That's a little different than confidence. I'm hearing empathy and warmth, understands me, versus confidence.
Well, it's all of those things. It's not simple things. We want understanding. We want this person to be empathic. We want them to, we want to believe that they're making an effort to understand us and our situation, and are confident that they have a plan to help us. So it's both of those things.
I'm a therapist. I've seen clients who say, my last therapist had a method, and she just was pushing that method. And this is what I'm doing on a good day. And the client says, I really appreciate it. I feel like you're getting me, you're understanding me. So I've experienced that, and just what you're saying, the one size fits all doesn't seem to work for most people.
It doesn't, and if you talk, just as you said, to patients, and they feel that this therapist was saying, well, just follow this plan,
mm-hmm.
you will get better, and isn't really listening to me, that doesn't work. And there's research for that as well, that therapists who kind of, call it slavish adherence to a treatment, don't do very well.
Well, now let's look at Martin Seligman is the father of positive psychology. And he's come up with the stuff that proves in his last book that if you take a course of 12 sessions of positive psychology where you keep a gratitude diary and write down what's good about you in life and have this outline of 12 treatments that help you see life in a different way and more positive, that's as good or better than any therapy.
Well, one of the things that psychotherapies have in common, we talked about all the different
mm-hmm.
types of therapy, is that they help the patient do something healthy for themselves. And so Martin Seligman's 12 components are involving getting people to do 12 things that are healthy for them. So there's nothing magical, frankly, about those 12 things.
Except it contradicts what you just said, I think. And that's that it's rigid. It's saying, here's the approach. And he says, session 1 we do this, session 2 we do that. Right. It's not taking into account the client.
Yes, and for those people who say these 12 things really make sense to me, I believe in it. Marty Seligman's a pretty smart guy.
Yeah.
He's a pretty personable, charismatic guy. As long as you have that belief and enact those things, it's going to be effective. But often there's people who aren't motivated to do that. They come to psychotherapy because they're frustrated. They've tried everything. Maybe they've even tried these 12 things and it hasn't worked. So that's where the skill of the therapist is really important, to engage the patient to do something different.
I don't want to get you in trouble. It sounds like you might know him or have some relationship, but are you saying he's not quite right, that you can take this procedure and always apply it to every client and you will have positive results?
Well, I think he would admit to that. Well, it's not going to work with 100% of the people. If it did, we wouldn't need psychotherapy at all, right?
Well, someone has to do it.
Yeah.
Well, yeah. But his test would show, look how well it works compared to random therapy. I do better with this than the average therapy does. If you just follow my technique with everybody who walks in the door, you'll do better than random
Well, I think
therapy.
the key is if you follow my techniques. If you follow my techniques implies that the person believes that this is a reasonable and has the potential. There's an expectation that this is going to help.
The patient
that
believes.
will work. Again, nothing magical, I think, about those 12 things. Again, psychotherapy across the board engages the patient to do something which is really healthy. Cognitive behavioral therapy, as we said, think about the world in more adaptive ways. Interpersonal therapy works on relationships with other people, close relationships.
Okay, let's take interpersonal therapy. Let's say in comes a client who's depressed, and underneath this is they grew up in a home where they were never enough. Whatever they did, mom and dad said, you can do better. Yeah, we want perfection. Didn't say those words, but that's the message they got. And they just feel they can never do enough. How can you approach this? The cognitive behavior therapy would be to change those thoughts, right? Interpersonal therapy, person has good social skills. They're warm, but they're hard on themselves. How is interpersonal therapy going to help them?
Well, my guess would be, and we'd have to know the individual patient, but those patterns from childhood play out in interpersonal relationships. So it interferes with the relationships because perhaps I say something that wasn't quite right to one of my friends, and then I worry about what effect this has, and it interferes with my relationship with that person. Could be a spouse. So there is an interpersonal component to this. And actually, if we look at the literature in social psychology, the social connectedness with other people is a strong predictor not only of mental health, but of physical health. So my guess is that somebody with those kinds of patterns or thinking that originated in family of origin are interfering with the interpersonal relationships currently. So interpersonal therapy is going to focus on that aspect.
Let's talk a little about the personality of the therapist and what impact that has. Who, if there is such a thing, is the ideal therapist that's going to have the most success?
Well, it's a great question. Decades of research would indicate there is no one personality structure that defines good therapists. Therapists, just like teachers, are quite diverse. So there's good therapists who are more structured, there's good therapists who are less structured, and so forth. But what we do find is, again, that the good therapists are able to form collaborative working relationship across a variety of patients. We find in our research, for instance, that those therapists who get better outcomes with adults generally get better outcomes with children.
Wow.
Those therapists who get better outcomes with severely distressed patients also get better outcomes with moderately distressed patients. So there is something that those therapists are doing that differentiates them. But it wouldn't be something you could measure with personality tests.
But wouldn't outcomes then help you figure out who to see? If outcomes were published, just like with surgeons, you want to know how many surgeons have had their patients die on the table versus good outcomes, right, to pick your surgeon. Wouldn't you want to know the same thing with psychotherapy?
You absolutely would, and it's interesting because people come to me and ask for referrals in Madison, and I make those referrals, but I don't really know whether that therapist consistently gets better outcomes. I like the therapist. It's somebody I would see personally. But you're absolutely right. It would be helpful if we knew more about what outcomes were actually achieved. And there are efforts going on to do this. There was an effort by one managed care company in California.
Kaiser?
No, this was actually Pacificare.
Okay.
But they were going to roll out a program where they had honors for outcomes, so they would identify on their website what therapists consistently got better outcomes than others.
But you don't have the results yet, or they didn't do it? Or?
Well, they, as in American business, were bought by another company, and so that program didn't get rolled out. But it makes sense from a number of different standpoints. We're looking at it from the patient. If you were going to see a therapist, you would want to see a therapist who consistently got good outcomes. If you're the manager of care, of a system of care, you want to hire therapists who are effective.
Yeah.
So from a lot of different perspectives, this idea of measuring outcomes is a useful one.
Yeah. Let me share with you my biases. I would assume the personality that would be best as a therapist, if I hadn't heard what you just said, is a person who's a warm person, who's got very good social skills, who is more extroverted than hidden, who's present, and who's bright. Now, wouldn't that be a wonderful package?
Well, there's some of those that have been studied. We do know that effective therapists have a sophisticated sense of interpersonal skills, so they are and communicate empathy. They're able to read the affect, the emotion of the patient, and modulate their response. So, in a sense, that's emotional intelligence. So, good therapists, there is a set of sophisticated interpersonal skills that good therapists have. The personality part of it is the tricky part. So, there are some therapists who are more extroverted than others, and that doesn't seem to predict outcomes.
Okay.
So that's more of a personality variable. But you're absolutely right about the interpersonal skills.
So if you are talking to someone and kind of implicitly judging her, that's not the right word, but you're thinking about, I wonder if this woman's a good therapist. Don't you have some sense, if you spend a half hour with someone and they're a therapist, whether their personality, you could picture them doing well in their practice versus not?
I could and I would, but the research seems to say that just by a little interaction, it's really difficult to predict what outcomes.
I hate that when the facts get in the way of my preconceived notions.
Right. There's a great study, and the outcomes of these therapists were known, and then they gave them a social skills test, a paper and pencil test. That really didn't predict the better therapist. But what did is, if they gave them a vignette of a patient and had them respond, how would you respond to this patient? Then in that context of doing therapy, we can seem to differentiate the better therapists from the others.
What about the degree? A master's in social work versus a PhD versus a psychiatrist who still might be practicing psychotherapy. Very few do. Does that matter?
Well, the research evidence that we've looked at, because we looked at that very question in almost 10,000 cases, and degree didn't make a difference.
No kidding. So people who want to become a psychotherapist and spend 5-6 years getting a PhD could have done it in 2 with their MSW.
Well, I'm a psychologist, so I will pass on that question too.
Politically incorrect answer.
You know, it's you see different kinds of patients in your practice, and so it's not definitive, but it does appear that what's important is the competence of the therapist and not the degree they hold.
And let's compare taking antidepressants or anti-anxiety drugs to psychotherapy. How do they stack up?
Well, there have been several clinical trials that have compared, and here's the general results. At the end of treatment, there's very little to distinguish psychotherapy and medications. Equally effective.
Okay, tell me if I'm wrong. When I see clients and the subject of drugs comes up, my bias is to say, let's not start with drugs unless you're suicidal or you can't get out of bed. And if you're functioning but you're depressed, let's see if psychotherapy works, because if you take a pill, you won't know what made you better, except the pill elevated the mood and treated the symptom, not the cause.
Well, there's some evidence to support that. So even though at the end of treatment, psychotherapy and medications are equally effective, even for fairly severe depression. Mm-hmm. However, longer term, psychotherapy is superior. More people relapse when medications discontinue, and it's probably for the reasons you say. In psychotherapy, you learn something about yourself, some coping skills, some ways to improve your life, and that seems to have a lasting effect. So in
right
the long term, psychotherapy seems to be more effective.
Because you're treating it symptomatically if you just do drugs, not the causation.
Well, it gets complicated because what is the cause of depression? We don't really know. There is a biological. Okay. Well, we don't. You look at the science of this. We don't know what causes depression, and there's many kind of psychological explanations. There's biological, chemical explanations.
So you think it's possible that depressed people are depressed for something going wrong chemically? You give them a drug that corrects the chemical imbalance, and now they're okay?
Well, let's not say it corrects it. It is good at reducing the symptoms.
Okay. I didn't mean. I'm sorry if I asked that with an opinion behind my.
What's important is, and there's some really interesting studies about this, the attribution we make. So if we attribute our improvement to taking a pill, when that pill is done,
yeah.
Then we feel like, well, I can't cope with this. My expectation is I'm going to relapse, and that's what happens.
Mm-hmm. So you don't know whether it's expectation or the reality the drug is not in your system, so you're...
Right. In fact, there's some very clever studies where people get psychological treatments, but they also get a placebo pill, a sugar pill.
Yeah.
And if they're told that their improvement was due to that pill, they will tend to relapse.
Oh.
Whereas if they're said, well, that's just a placebo pill, they don't. Well, fascinating.
Exercise. John Grice did a study here in our town, a psychiatrist, a long time ago, comparing jogging every day to psychotherapy to medication, and said jogging's just as good. What are your thoughts on exercise and depression and mental issues?
Well, there's just recently an article that reviewed a variety of different healthy practices and how they're related to mental health. There's no doubt that eating better, avoiding excessive use of alcohol, not smoking, exercising are all related to positive mental health. So, yes, I mean, why wouldn't we do healthy things to make ourselves feel better?
Does exercise...
The people that come to psychotherapy, though, are the ones who have tried by themselves a variety of different things, and it hasn't worked.
Well, should these be protocol if someone comes in for depression to suggest they do these things as well as the work and things?
I would think so, and I think most therapists want to encourage patients to do things that are healthy for themselves.
As we close, I do want to ask you how to shop for a therapist, but is there some subject area that we really should bring out on this subject that I haven't in my questions that you want to make sure gets in?
Well, I would just emphasize again that the important thing is that somebody choose a therapist with whom they work well and they seem to improve. So if you haven't improved after 4 or 5 sessions, you should bring it up with your therapist.
Can you tell if you like the therapist in the first session or two that this is right for you, and if you just don't like them very much, that's not the right therapist?
Well, I think we have to be careful because sometimes our mental state when we go to a therapist interferes with forming that relationship. We're extremely depressed, we're irritable, we're judgmental.
Yeah.
If we just go from one therapist to another saying, they don't fit with me. So you have to give this 5 or 6 sessions, and you really have to make good faith effort to engage with the therapist. If you're not getting better or you don't think the work is productive, discuss that with your therapist. And that's a very important part of the process, is feeling free to have that conversation with your therapist.
Well, Dr. Bruce Wampold, thank you very much for filling us in. I wish it was a little clearer. Here's exactly what you want, a therapist who smiles and has a deep voice or something, but I guess it's not that simple. And I hope you'll join us on the next edition of Insights.